How was your day yesterday? Everything went well?
Really good day. Thank you very much. Very pleasant. The weather was quite good, actually. It was lovely
It
weather.
was.
It
It
was
was.
amazing. So yeah, so
Yeah.
we had a really nice time, and yeah, the days are just going by, and I think we're just still keeping very safe. I don't think we are sort of taking chances in terms of
Did,
going
did,
to the shops and
did you go to did you go into the shops then?
No, I didn't, but I
No.
was tempted to. I actually did want to go into Primark and a few of the other shops,
Hmm.
but I held myself back. So let's see. We will plan to go to the shop sometime soon, but maybe not as of yet. Yeah.
Yeah. Yeah. Okay. Right. Let's crack on with this COVID-19
Yeah.
situation.
Yeah.
And as I was
How
saying,
was your day? Did you go out or did you do
yes, I did.
anything?
But to the supermarkets really, to Tesco, and
Okay.
then drop something off to
And
Bridget, and then that's it.
and how was
And then
it?
I
Is it
came.
quite busy or what do you
It
feel?
wasn't. It wasn't busy. I mean, it wasn't busy at all. It's just normal and not busy Tesco day.
Yeah.
It was, yeah, yeah. So just went in and then out,
Yeah.
just grabbed something for Bridget, took it to her, and then came back home because I had a lot of work, loads and loads of work to do at home. So I was
Can
just,
you imagine?
yeah, I was at home, meetings and all that,
Yeah.
everything. But anyway, everything was good and everything is good.
I
Now,
think that's great to hear. And I think just on that point is just to say, I think most shops will be like that. It's more the bigger shops and the clothing stores that were
yeah,
not
it's the
available
non-essential
online.
shops that, yeah, well, because people haven't had the chance to shop in them for a long
Yes.
time, and a lot of them are they're doing massive sales and all that. I know
Yes.
for a fact that
Tempting.
Debenhams, they're doing
Yeah.
some serious sales, and
Yeah.
so people are just gonna rush in and get what they want. You
Yeah.
know, yeah. Unfortunately, I got some bad news yesterday about my cousin lost his wife yesterday. And
Where
in London, yeah. So that was really shocking, and because
Sorry
there
to
was
hear
nothing.
that. So was it COVID related or
No,
just
no, it's not
not?
COVID related at all. She wasn't ill or anything. She just wanted to have a little lie in before they would go to Billingsgate to get fish.
Yes.
And just I said to the husband, "Wake me up." After a certain time, he went to wake her up, and she was gone.
Sure, that is so sad. I'm truly
Yeah,
sorry to hear
yeah,
that.
yeah, yeah, yeah. And so
So
I probably will have to.
condolences to him and his family. It must be quite shocking.
Yeah,
Yeah.
it's quite shocking. If it shocked and shook me, then you can imagine what it's doing to him. So I might have to just
Go.
rush into London, just to make sure that he's okay and safe and
Yeah. Do they
everything.
have children as well? Or
Yeah, they got 5 kids, so you can imagine.
sure.
Yeah. So anyway, right.
Oh well, I mean our prayers with them and with her to rest in peace and
Yeah,
yeah.
absolutely. That was really shocking, and I'm still shocked, but
Yeah.
that life goes on,
Mm.
doesn't it? Anyway, well, they think that most positive rapid coronavirus tests taken since the 8th of March appear to have returned a correct result. There was this issue about people saying that some of these tests are not correct, and
Yes.
yeah. So there was that fear that when you take a rapid test,
Yeah.
you'll have to reconsider it and all that. But the experts are telling us
Yeah.
that it's good,
Yeah.
especially since secondary school pupils will have to take 2 tests a week. And some of them are doing the lateral flow test and all that.
Yeah.
And yeah, so it's a good thing that at least we know these tests are correct. If 82% of them are correct, then it's good.
Yeah.
Yeah.
So yeah,
What's
I
your
mean,
opinion?
yeah, I think yeah, so that's important. That obviously that it is still accurate. Is that what we're
Mm.
saying, isn't it? It's still accurate.
Yes, it is. It's accurate. Yeah.
Yeah, and that it's so, I mean, it's mostly a true positive, as
Mm.
opposed to false negatives or false positives.
Yeah.
Remember when we spoke about tests about specificity and sensitivity? So
Yeah.
meaning that sensitive means how sensitive the test is to actually testing what it does. So, for
Yeah.
example, if you're getting tested for COVID-19, how sensitive is it at picking up actual COVID-19 or not picking it up? On the other hand, and then specificity, it means how specific it is to pick up COVID-19 or not to pick it up. So if you get a result, so what this all boils down to in just layman terms is, if you get a test result, is how accurate it is. So how
Yeah.
specific and how sensitive it is. So I think,
Yeah.
is that what we were trying to talk about? Yeah.
Yeah,
Sorry.
yeah, yeah,
I think I'm still
yeah,
waking up.
yeah,
If you
because,
can,
yeah.
I'm
Well,
awake,
I remember
but I'm
you
still
teaching
trying to
this.
wake up. But that was what my brain was telling me.
Well, what the teacher
I'm
always a
having one of
teacher.
those mornings.
Don't worry, teachers are good at that. They think they're not awake yet, but they are awake, because I do understand. I did understand what you just said, because you've taught us this before, haven't you?
Yeah, we spoke about it.
Yeah, and they're saying that, the PCR test is a slower method of,
Yeah.
they take their time and all that. And then we've got a lateral flow one, which is the 30-minute one. You just stick it in your throat and your nose, and then half an hour later you get the result. And there's this school of thought that the lateral flow is not really solid. It's not solid. But then the experts are telling us that it is.
Yeah.
It is.
Exactly.
And,
so even though obviously it's I think probably maybe so 82% of the positive rapid tests were correct. So I think, so it means that 18% was not. So obviously it's obviously, why is it that 18% was not accurate? So I think this is obvious, but still, in terms of
in terms of numbers and proportions, it's very good, because if 18% is better than say 30%. You understand? So so it's
so I think why they're saying that is because, like what you said, is 82% was positive, but then 18% was negative, meaning that 18% or 3,034 of those suggesting that the individual concerned and their household had been self-isolating for no reason. So a negative test would mean that their quarantine period would be over. So I think that was obviously, and that's rightly so. That is a concern. So as it stands, is from what I was saying then, I've woken up now. So the sensitivity and specificity is not as accurate as we would like it to be. So there is a chance that it will come back negative. So that's what it's saying. But it's but majority will be positive.
Yeah, that's what it's saying. But what I think they're trying to put across to us is that even though there's an 18% chance of it not being correct, what was previously thought that a lot of it is not correct, it's wrong, and therefore if we have 82% which came out as correct, then it's a good thing. It's a good thing as compared to what was previously thought. You understand? And the government has said that these rapid tests using lateral flow, the kits, it gives results in 30 minutes, and they're saying that it will be fundamental in helping to prevent future outbreaks of coronavirus. So it's better than not testing at all.
Exactly. So I totally agree with that. So it's obviously I think people just need to get tested and then take it from there. So I think that's possibly what needs to happen, is that and I think what you are saying as well is, that the testing should continue. That's what the scientists are saying, that we've got these results, but we have to still get tested, and most possibly that most of the results are still accurate.
And the other story is that care home staff in England could be mandated to receive a coronavirus vaccine in new plans under consultation by the government. And ministers are actually seeking views on the proposal, and which would see the jab requirement introduced this summer. as early as this summer. And Matt Hancock is saying that requiring a jab was something many care homes have called for and would make care home residents safer.
Yeah.
So what it means is that if you're care home staff or worker, you must, when this thing comes into effect, you must have a coronavirus jab.
Yeah.
Or have vaccine. So you cannot work in care homes if you didn't have any.
Yeah. And I think that's important because we know that the older population is at vulnerable and at high risk of getting COVID-19. And if we have staff going in and out of care homes, and if you remember early on in the pandemic, there was a lot of scrutiny on the government with regards to care homes and people dying in care homes. And also the virus spreads quite rapidly. Because it's a confined space and the residents are not going out, but obviously they are posed with a risk because their staff are going in and out and going to their families and coming back. And we know that people have gotten infected like that. So I do think obviously then this is just a precautionary and so I think probably in response to what has happened in the past, the government is obviously thinking about their strategy and ways in which they can reduce the risk to the elderly population in the care homes. So it is quite good news actually in terms of what they're trying to do, but obviously in terms of each person deciding, so it will depend on whether that care home staff will take the vaccine or not. But it seems highly likely that they will need to be vaccinated to reduce the spread, reduce the hospitalization and risk of getting COVID-19. So they're doing a 5-week consultation launch where they'll be looking at care providers as well as caring for older adults. And they will only deploy workers who have received the COVID-19 vaccine to protect the residents who are amongst the vulnerable. So Matt Hancock obviously is saying that older people are at most risk of developing serious consequences of COVID-19. And that's why they are doing that.
Right. Well, is this not taking us gradually into the COVID passport thing?
Yeah, I was thinking that.
Yeah, because if for example you work in a care home and you must have, so this in effect is a COVID passport.
Yes, so I think
you'll have to have it to work there, and then gradually it will be moving to other sectors of the community, and then probably the travel community as well.
Yes, exactly. So I think this is probably the beginning of the implementation of the COVID passport or the COVID pass or the certification system, whatever they're going to be calling it, whether it's going to be digital or non-digital. So yes, it is already. So it's already showing that they're going to. It's like enforcing rules, isn't it? And like we had the COVID laws that came in, so it's again they're enforcing rules, and it's going to happen, as you said, in other sectors. So other parts of the health sectors, doctors, nurses, other professionals working in hospitals, and then it will obviously go to the travel sector as well, or whether that's all going to happen at once. But this is definitely the beginning of it. Yeah, but I mean, so they are saying, so it's quite specific. Care home staff in Milton Keynes may be required to have COVID-19 vaccines to keep working. So they are saying it's going to be compulsory. So it's basically a provisional government proposal to. So they're basically threatening mandatory, according to the article, threatening mandatory COVID vaccinations. As a requirement to continue with contracts. So so it's going to be quite interesting, I think.
Yeah. It is, and but in that same vein, or in a related story, the Equality and Human Rights Commission are saying that certificates to prove who is vaccinated could help to ease restrictions in principle, but that could also create a two-tier society whereby only certain groups are able to fully enjoy their rights. So they're talking about human rights situations here. Even though they do agree that this COVID passport situation would would help to ease restrictions. But at the same time, and they're saying that would happen in principle, but at the same time, if it will become a two-tier system, or so two-tier society. Yeah. Those who have the passports and those who do not, and they're saying that it will infringe on people's human rights, especially those who cannot have the vaccine because of medical reasons.
Yeah. So COVID status certificate system could be unlawful discrimination, says the Equalities TM and what you said, the Tier 2 society. So that's interesting, I would say, and obviously very much a reality of what will happen. So I think they've understood that obviously it is going to create sort of a gap and a bridge, obviously, between people that are going to get the certificate and vaccine and those that are not. And obviously human rights coming into effect, which is not a surprise, because on the one hand there's human rights, on the other hand there's also the some people might not be able to get the vaccine, or they've chosen for various reasons not to take the vaccine. And as we know, vaccines have side effects as well. So it's weighing the risks and benefits. So on the one hand, people getting the vaccine, the other hand, the people that don't get the vaccine, what's going to happen? So it is going to, and it's going to affect everything. I think all jobs, everything is going to require the COVID pass or certification or vaccination. So I think people are going to be pressured. Even if they didn't want to take the vaccine, they will be pressured into it. But my concern would be the people that can't take it for some reasons, pregnant women and other high-risk people, if that cannot take it, what would happen to them?
Yeah, I read something yesterday. I can't remember exactly where I read it, but I did read something yesterday about certain airlines, for example, they're planning to make a decision about who gets on their flights to and from wherever, and that they're saying that they would, for example, if you've had the both vaccines, you've had the 2 jabs, then you might not be required to do a test before you leave or when you're coming back in. It is just a rumor. According to what I read, it's not something that is been confirmed by any airline or whatsoever. But it's just a rumor. I'm just bringing it up because there is a possibility. There's a huge possibility of this happening. That, for example, if you're traveling outside this country, for example, you would have to get a test. But then, if this thing happens, what I'm saying happens, then you will not need a test if you've got both jabs. If you've got your jabs, you're vaccinated, then you're so safe to travel.
Yeah. So I do think, possibly that is probably going to happen, as you said. Yeah.
Be careful what you predict.
Yeah, no, we have to be pretty careful.
We have to be careful what you predict because it always happens. Anyway.
You saw me hesitating to say anything more.
Yeah, it's a good thing you didn't say much.
Oh dear.
Anyway, so I think we should just do the numbers.
Okay, yeah, sure. Yeah. I mean, I was just going to check if there were any other stories that caught my eye, but just the update from India seems very concerning still, and obviously Maharashtra was quite worrying. And Delhi and other places, and so it is very much a concern. People are getting infected, and India is in a crisis at the moment. And obviously, I think Narendra Modi has issued certain lockdown restrictions in certain places and curfews. So I think as of yesterday, from 10 p.m. I think till the 1st of May, there will be restrictions for people in India. So.
And another country that's really concerning me is Ukraine.
Yes.
We talked about Ukraine yesterday. It was was it 14,000 new cases or something like that?
Yeah.
Today it's 16,000 and over.
Yeah.
In the last 24 hours. This is crazy. And
so that's really worrying. Yeah.
It is really, really worrying.
I mean, India sees 184,372 new infections in the past.
India.
Yeah, that's what they're saying. Yeah, 184,372 new infections in the past.
Oh my goodness.
24 hours. So I think India is definitely the deaths are rising as well as the figures of people. And there were millions of Hindus pilgrims which gathered in the temple town of Haridwar in Uttarakhand to celebrate Mahakumbh Mela. So it's a celebration. And there were like a lot of people at the festival. There were police as well, and around 650,000 people had bathed in the river Ganges on Wednesday morning. So that's a bit of a concern. So obviously, I think because of the...
What did you say the number was in the last 24 hours?
I think for me it's at 182,000.
Right, you probably need to refresh it because I'm seeing something, and that in the last
184,372
new cases.
I'm
looking at on 14th of April, which was yesterday, it's 199,000.
So maybe it's gone up, yeah.
Yeah, 569 new cases, and then today, the 15th, it's dropped significantly to 3,674 new cases.
But possibly they're still going to have to, after the celebration.
I don't think it's conclusive here. The reason is because it's not even giving me the new deaths, and probably because of time zone.
Yeah.
So it will come later.
Yeah.
It will come later. But as on the 14th of April, that was yesterday, they had 1,037 new deaths in the last 24 hours.
Yeah.
That is absolutely crazy.
Yeah.
So that's bad, man.
So it is obviously very concerning in India, and hopefully Narendra Modi is doing his best, the Prime Minister, with the rest of the ministers as well as the education. I think they were looking at exams. So I hope.
Yeah.
We'll pray for India and for the rest of the world that.
Out of curiosity, can we quickly check what the situation is like in Ukraine? Because I'm really worried about Ukraine. Let's see what the numbers are like in the last 24 hours with Ukraine. Where is it? I'm just trying to.
So I've got
Yeah, I've got it too. Yeah.
Okay, go on.
So it's 16,000. The new cases 16,427 in the last 24 hours, and 433 new deaths.
Yeah. So that's Ukraine. Yeah.
Yeah. Okay. All right. Okay. Shall we just
do the rest of the numbers?
The rest of the world. Yeah.
Okay. So in terms of the Worldometer figures as of today is the 15th of April 2021. We have 138,865,551 positive cases globally. The number of deaths nearing 3 million, which is 2,986,118 globally. Deaths and total recovered 111,647,082 recovered. USA remains number one with 32,149,223, and total number of deaths is 578,092. India is number two with 14,074,564 positive cases with 173,152 deaths. Brazil number 3 with 13,677,564 with 362,180. And there was an article on Brazil, so we'll probably talk about it tomorrow, but they were talking about why people in Brazil are dying. So the people, so as you can see, the figure of Brazil deaths is much higher than even India. So it's the second highest.
Yeah. Well, can you briefly tell us what the reason is, if you don't mind?
So yeah, I'll just have to, so Brazil, they were saying that there's obviously reasons why Brazil is, why so many people are dying. But we also know that Brazil, we had the Brazilian, the coronavirus, isn't it? The variant as well. Yeah. So, so Brazil has more than 4,000 deaths in the in 24 hours for the first time. So it's recorded quite obviously 4,000 in the last 24 hours, and it's because of the COVID, the variant. So it's a new contagious variant, and the hospitals are overcrowded with people dying, waiting for treatment. So President Jair Bolsonaro continues to oppose any lockdown measures to curb the outbreak. So obviously the Brazilian variant is a concern, and this is the reason why people are dying. So yeah, probably we can talk about the variants tomorrow. So just to say, the Brazilian variant is so that they've actually detected 92 variants of the coronavirus in Brazil, including the P1 or the Brazil variant, and that's the one which has been concerned. And it emerged in the Amazonas state in November 2020, and it's spreading to Manas, as we spoke about previously. And it accounted for 73% of the cases in Brazil. So they're saying that, so this is, they're calling it a tragedy. And that, again, so the variant, so this variant obviously is in Brazil with 63,000 people who've had this Brazilian variant. And they've got other countries in the rest of where they've also shown about this variant. So like Mexico, Peru, Bolivia, Paraguay. Yeah. So it is a concern. Yeah. So Brazil is obviously something to watch about because they're second on the list in terms of the number of deaths.
Yeah, absolutely. Okay.
Yeah, so France, number 4, with 5,149,834 positive cases, with 99,777 deaths. Russia, number 5, with 4,666,209 positive cases, with 104,000 deaths. And UK, number 6, with 4,378,000 cases, 305 positive cases, with 127,161 deaths. And Ukraine, you've spoken about already, which is 1,903,765 positive cases, the number 16 in the world, with 38,658 deaths. And South Africa, number 20, so they're moving up, 1,561,559 positive cases, with 53,498 deaths. And Ghana, number 90. So Ghana is still doing quite well. We need to catch up. Ghana seems to be doing really well. They're 91 in the world, and so they've done so well, with 91,477 positive cases, with 763 deaths. And UK 24-hour figure, bearing in mind that there's been lockdown measures eased and also holidays. So as of today, we've had drum roll. To 38 new deaths. So every life matters, but that's still low, and 2,491 new cases. So the numbers have definitely gone down, and hopefully we'll continue to see it stay at this level. I think this is a combination of a lot of things. A lockdown, people are more sensible. They're listening because they don't want it to go into lockdown. You know, we all know what our life has been. You know, we've just only seen like four walls. You know, that's all we've seen, and the screen. So I think people want to live. They want to go back to as normal a life as possible, and I think everyone's doing their best. So, you know, hats off to every single person that's listening and that's taking precautions, and not just keeping themselves safe, but keeping everyone else safe, reducing the spread, reducing the risk of deaths, and reducing the risk and burden on the NHS and our hospitals. And our, you know, heroes that put their lives on the, it's just amazing how the nurses, doctors, and other professionals and people in the shops, and, you know, ambulance drivers, and, you know, all these people, porters and people that work with garbage and the streets to keep it clean, all these people, and on the trains, you know, transport systems, they all do so much. So really, we're so grateful to all of them, and we really need to continue to keep everyone safe. So yeah, let's spread the love and not the virus, and let's stay safe, everyone. Thank you so much. Have a fantastic day. The sun is out, so
it's beautiful out there. I'm looking.
I think we're gonna have a barbecue or braai, even if it's just burgers on the braai. I think I'm gonna make it very easy today and just enjoy the sunshine.
Fantastic. Go for it, lady. All right, all the best, Dr. Seshni, and my love to your family and everybody. Right, I'll see you tomorrow.
See you tomorrow. Lots of love. Bye.
Okay.
Bye. Thank you. Thanks everyone for joining the Hospital Radio Bedford. That was me with the Popo Apari with the COVID-19 update. So thank you so much, and lots of love, and namaste, guys. Have a fantastic day and stay safe.